Welcome participants to this CME certificate course in diabetes management or CCCDM. This is a module based e-learning program jointly conducted by the Chalaram Diabetes Institute and endorsed by the Leicester Diabetes Centre in the United Kingdom. In addition to didactic lectures, we will have pre-tests, post-tests and learning activities. This course is designed to give a basic overview of diabetes to both the internal medicine doctor and the primary care practitioner, but I think the diabetes being so common, doctors of various specialties will benefit by undergoing this course. Let me start by introducing the first module, which is actually an introductory module which looks at an introduction to the various aspects of diabetes. Let's go on to the learning objectives of this course. The learning objectives are to understand the definition of diabetes, the epidemiology of diabetes, the classification of diabetes, the pathophysiology of the various subtypes of diabetes, the diagnostic criteria for diabetes, and of course, a general overview of the complications of diabetes. This slide shows the definition of diabetes. We define diabetes as a disease in which the body's ability to produce insulin or respond to the hormone insulin is impaired. And this results in an abnormal metabolism of carbohydrates and elevated levels of glucose in the blood. Well, while this is a definition, I'd like to make a few points here. The first point is that diabetes is characterized by high blood glucose. Hyperglycemia is a hallmark of diabetes. In addition to impaired insulin production and impaired insulin resistance, an excess of the hormone glucagon, and of course several other factors including the adipose tissue, the brain, the kidneys, the intestine, all play a role in the metabolism of glucose. And an impairment of the metabolism of glucose will lead to hyperglycemia. But the simple way to remember is that if insulin cannot be produced, or if insulin cannot act, or the body cannot respond to insulin, then the blood glucose levels rise and we call the condition as diabetes mellitus. We now go on to the occurrence of diabetes across the world. This is a graph that shows you in the x-axis the various years at which measurements were taken, and in the y-axis it looks at the millions of people, adults between the age of 20 to 79 who were diagnosed to have diabetes. You could notice that in the year 2000 about 151 million people were diagnosed to have diabetes. If you look at the year 2009, the number rose from 151 to 285. So in 2009, 285 million people around the world had diabetes if you look at adults between the age of 20 to 80 years. We now go on from 2009 to 2013, and the number has already risen from 285 to a mind-boggling 382 million people in 2013 itself. And from 2013, we now look at the year 2017, which looks at a staggering number of 425 million people with diabetes, adults with diabetes, adults between the age of 20 to 79 years with diabetes across the world. And you will agree with me that this presents a public health crisis for the world, because the increasing occurrence of diabetes is linked to the increasing occurrence of diabetes related complications and mortality. Now if you look at this slide, which shows the projected increase in diabetes from the year 2017 to 2045. Now in the world, the projected increase is from 425 million to 629 million subjects, and this represents a 48% increase. And if you look at where the increase is coming from, about 156% is coming from the rest of Africa, which excludes the North Africa and parts of the Middle East close to Africa. 84% is the increase that's going to be seen in Southeast Asia, and 62% is the increase in diabetes that is going to come from South America, and from North America and the Caribbean the increase is going to be 35%. From Europe and Australia that is Western Pacific, the increase is about 15 to 16%. So you will see that in Africa and Asia, there is going to be a remarkable increase in diabetes, which is of course a projected number from 2017, the year 2017 to 2045, and that's a 48% increase. Now predictions are always predictions. Predictions are there because we can predict the future. But you will agree with me that it offers an opportunity to prevent diabetes, and I would be happy to see this prediction proved wrong if we can reduce that 48% increase to say 20% increase or lower. So I think this calls for a concerted effort by patient support groups, healthcare providers including physicians, diabetologists, endocrinologists, public health experts, policy makers across the world to put systems into place to stop the escalating epidemic of diabetes, which would lead to its complications, including neuropathy, nephropathy, retinopathy, which we'll discuss, and of course death. And this slide will show you the region-wise diabetes attributable deaths. And this looks at just the year 2017, the number of deaths in adults in the year 2017 in millions. And you will again see that Southeast Asia, there are about 1.1 million deaths. The value is 1.3 in Western Pacific, 0.5 million in Europe, and the rest of the world ranges from 0.2 to 0.3 million. Again, showing you that diabetes is associated with not just morbidity, but significant mortality as well.